always, hope you guys are doing well and staying safe. Today, I wanted to talk to you, give you a brief overview again, if you have missed any of my video, about male-female pattern baldness, which is another name from androgenic alopecia. As you know, I was diagnosed with androgenic alopecia back in 2017, and I gained a lot of my hair back, and I would say more than 2/3 of my hair back. But recently, due to COVID, I lost a lot of hair, and then stress, and some side effects of some of the medication I have to take. So I will give you like a brief overview of what androgenic alopecia is, what kind of treatment is available, what the symptoms are. So let's begin. So the name androgenetic alopecia was used in the past, recognizing the hormonal influence of the underlying condition in men. So as we learn more and more about the physiology or the gene and physiology of this condition, the terms expanded. The newer terms do look at the different patterns and presentation in both men and women, and the uncertain role. So now male pattern hair loss and female pattern hair loss are now the favorite terms. Androgen is considered necessary for female pattern baldness to develop. It typically begins after puberty, which is marked by striking or increase in the androgen level, and DHT is a part of testosterone synthesis. However, the relationship between androgen and female pattern hair loss is less clear. Female pattern hair loss has been observed in women with high androgen levels, but it has also been seen or documented in a pattern with complete androgen insensitivity. So most women with female pattern hair loss have normal testosterone levels. They lack increased androgen. So the role of estrogen in the development of female pattern hair loss is also unclear. The amount of, or the prevalence of hair loss increased after menopause, and so there's conflicting evidence regarding whether estrogen stimulates or inhibits the hair follicle. So this pattern hair loss in both men and women begins soon after puberty, and thinning of hair and the non-scarring loss of the hairs result in decreased amount of hair density, generally progressing slowly over years, and the scalp is healthy otherwise, and the scalp is healthy otherwise. In men, hair loss typically affects the central scalp, including the mid-frontal, temporal, and the vertex, which is like this part. In women, the characteristics or distribution of hair loss is different. Female pattern hair loss has two general distribution. So it's basically diffused thinning across the central scalp, and Christmas tree type pattern is observed in female pattern baldness. So the frontal hairline is less likely to be involved, but the bilateral temporal thinning is common. So for females, thorough history of symptoms and condition is usually asked by the provider or by the doctor, including severity, hair loss distribution, progression, for example, periods of shedding, and the other symptoms. And for women, other factors include gynecological history, which may be polycystic ovarian syndrome or PCOS or hyperandrogenism. Also, which family history play a role. Metabolic syndromes like diabetes and excess androgen, medical history, they all play a role in female hair loss. Conditions that women that worsen hair loss include iron deficiency, thyroid dysfunction, nutritional deficiency, and all of this has to be taken into account to manage or improve the treatment result. So when you go to a dermatologist, they usually do a complete skin evaluation, including your face, scalp, nails. And when they're examining the scalp, they look at the distribution of hair loss, the type of caliber of the hair, and they look at the pattern of hair loss, and look at skin hair miniaturization, and compare it to adjacent hair shaft. Look at if there is inflammation, scarring is involved in the scalp. It suggests a different type of diagnosis, just not like a pattern hair loss is usually unaccompanied, or this any kind of pattern hair loss usually don't have the scarring or inflammation of the scalp. But nevertheless, seborrheic dermatitis is also common in people with pattern hair loss. So seborrheic dermatitis is often associated with oily scalp, which is a result of androgen stimulation, nail involvement, such as ridging, patchy hair loss of non-scalp region like your eyebrows are not consistent with the diagnosis of male or female pattern baldness. Hair pull test is a useful way of detecting active hair loss, and it's done by grasping 50 or 60 hair close to the scalp with the thumb or middle fingers and slowly pulling it. And if 6 or more hair comes out, then the hair loss is active. You can see I have like pulled at about 2 hair, so it's getting better. Before, like clumps come out every time I did it. And the extracted hair, usually the doctor, they examine it under the microscope to look at the type, the phase of growth. And previous studies have suggested that neither washing nor brushing the hair affects the result of hair pull test. In pattern hair loss, hair pull test is generally negative, though it can be positive early in the process. And another thing that the doctors do is called dermoscopy, and it's the examination of the scalp. They look at the scalp with a dermoscope and can look at the epidermal and the dermal structure of your scalp, which is not detectable in naked eye, and the pigmentation and the lack of scarring are consistent with the male or female pattern hair loss. And small areas with complete hair loss may be observed, and skin pigmentation in these areas may vary due to sun exposure. Thing that the doctors does is scalp biopsy. So it's generally not required, but a scalp biopsy can be helpful when the clinical picture is not clear. There is other condition coexisting. So what they do is they do a 2 4mm biopsies, punch biopsies in the direction of the hair shaft, and they look at the histological feature of male and pattern hair loss. Usually the hair shaft diameter is less than or equal to 0.03mm, and there's increased percentage of telogen hairs and reduced amount of total hair per area. Laboratory tests are also done, such as thyroid stimulating hormone, iron studies looking at serum, ferritin, iron, total iron binding capacity. This can be helpful in assessing male and female with pattern hair loss, women with clinical manifestation of excess androgens such as adult acne, undergo lab workup for hyperandrogen or increased androgen. This includes free and total testosterone, and they also measure serum prolactin, which can be considered for women presenting with elevated testosterone. A complete blood count, metabolic panel are also done. Looking at ferritin, zinc, vitamin D level is also done. There are other forms of alopecia which can be present, which is telogen effluvium, which I told you about in previous video, alopecia areata, traction alopecia, trichotillomania, and centrifugal alopecia, lichen planopilaris, and frontal fibrosing alopecia. And I will go into each of these other type in future videos, but it can be psychologically very traumatic to have hair loss. So I wanted to make sure I give you like a brief overview of the pattern hair loss or androgenic alopecia and how doctor diagnose it. The type of treatment that is available include minoxidil. So minoxidil enhance hair growth by enlarging the miniaturization of the hair follicle, extending androgen, and shortening the telogen phase. And minoxidil has been approved by U.S. Food and Drug Administration for treating both male and female pattern baldness. So typically, the topical minoxidil is available over the counter, 2 to 5%, and 5% foam in the United States. Usually you apply one, you part your hair and you apply it. Studies have shown that the hair is effective treatment in both male and female. And what are some of the side effects of minoxidil? It's stimulate telogen follicles to enter anagen. So there's a transient or short-term hair shedding which may occur in the initial part of the study, and contact dermatitis are common side effects. As I said, my hair was itchy, I couldn't do it. And in terms of medication, there's medication called finasteride, which is decreases the production of DHT, and the oral finasteride reduce scalp DHT levels by approximately 60 to 70%, depending on the dose. However, like a double-blinded placebo-controlled trial showed that finasteride 1 milligram to be ineffective in women who are menopausal with female pattern hair loss. There are other medications that are prescribed is spironolactone, PRP, laser therapy, which I showed you about, niggling, hair transplant. So those are some of the other treatments of pattern hair loss. So I hope you find this video helpful. Please do let me know what else you want me to talk to you about. And if you have not subscribed to my channel, please subscribe, like the video if you find it helpful, and put comments as to what you want to see in future videos. So until next time, take care, hi, and happy viewing.